Hi everyone, Dr. Bishop again. Here I'm going to give a short video on understanding articles about harm. In this video, we are going to lay out the framework for going through the 3 stages of appraising a research article looking at harm. Let's start with a case. You are a third-year medical student who is doing your primary care rotation. You're seeing patients with the resident, and the first patient of the day is an elderly gentleman with dementia who is coming in for a routine checkup. His daughter is at the visit and asks to speak with you and the resident outside of the room. She is concerned because her father has become increasingly combative. He is lashing out at his home health aides, and several have quit after caring for him. She really wants to keep her father at home and wants to know if there is anything that you can give him to counteract his combativeness. The resident brings up the option of an antipsychotic medication, which may help with the behavioral issues. But then she says she has read a recent report of kidney problems with this medication, particularly in older patients. She says that she'll be in touch with the patient's daughter after she does some research on the issue. But the resident is swamped and asks you, the third-year medical student, to find the evidence about antipsychotics causing kidney injury. Before you search the literature, you develop the following PICO question. In older patients, are antipsychotics versus no antipsychotics associated with kidney injury? Using this PICO question, you use PubMed to search the literature. Ideally, like an article about therapy, you would like to find a randomized controlled trial comparing patients who were exposed to antipsychotics versus those that were not exposed, and then look to see whether they had differences in the development of kidney injury. But you have a hard time finding an article with this study design. There are 2 reasons why this might be the case. The first reason is that sometimes ethical issues come up. Imagine going up to a group of patients or patients' relatives who need to consent to a study and saying to them, "We think there's a connection between antipsychotics and kidney failure. We'd like to enroll your father. There's a 50-50 chance that he will be in the antipsychotic arm and may have a higher risk of developing kidney injury." I don't think a lot of relatives would enroll their parents in this kind of study, and you may run into issues with your ethical board, known as the IRB. Second, the harm outcome may be very rare. You would have to enroll an enormous number of patients in a randomized controlled trial to identify a small number of events. So how can we get around this issue? Let's go back to 2 study designs that you learned in previous sessions. These are cohort studies and case control studies. They are both considered observational studies because you are not implementing an intervention or exposure, but are looking for naturally occurring exposures or interventions. You are then looking for correlations between that exposure and your outcome. Now that you know you might not find an RCT on this issue, you research the literature and find a study published in the Annals of Internal Medicine that you think will answer the question. Like almost every research article, it follows the same format that we discussed in the Anatomy of a Research Article video. A copy of the article is in Canvas. Feel free to read it now or refer back to it as we go through this video and the next few videos. Like every research article, we're going to go through the 3 steps of critical appraisal. In the next video, we will focus on the first step. Are the results of the study valid?